Welcome to Leadership and Culture in Healthcare, the podcast from me, Matthew Winn, on insights from leaders in healthcare, looking at all things leadership and culture. This is the kickoff introduction to Series 2. Yes, we're on Series 2, and I hope you have enjoyed Series 1, where we have 13 episodes exploring with NHS chief exec leaders and culminating in episode 13 with Michael West, delving into the theory, the research, and his huge experience. Series 2, however, is going to take a little bit of a different approach. Series 2, we are looking at leadership roles in national organisations. So we will be hearing from the Patient Safety Commissioner, General Medical Council, the Nursing and Midwifery Council, the National Guardian for the NHS, Care Quality Commission, Health and Care Professionals Councils, and the Parliamentary and Health Service Ombudsman. Now, you might say, well, that's a bit of a departure, Matthew. Why are we focusing on those organisations that are remote, potentially, from how care is delivered, or however you deliver your care, whether you're an NHS organisation, independent sector, primary care, dentistry, social care? But my reason for inviting the leaders of these organisations is to get underneath the skin of how, as national organisations, do they, as leaders and in their remit, support healthcare providers to have great organisational culture? How do they support providers of healthcare to enhance great leadership? And I think then also, what do they do as national leaders that benefit the patient? What do they do in their organizations that is directly attributed back to supporting frontline care to do their job right? Now, on some of those, I imagine the listeners of this podcast will say, yeah, I kind of understand the Care Quality Commission. They're our overall quality regulator. The Nursing Midwifery Council and the General Medical Council have accountability for the vast majority of our professional staff. But what about those other areas? When it comes to the Parliamentary and Health Service Ombudsman, I, as a jobbing chief exec, know the importance of those roles because they're crucial, and they're crucial outlets for patients when things go wrong, and to be really flagging up that things need to improve, or the NHS, the independent sector, the private sector needs to get their act together in doing those things well. So those are the themes, folks, that I will be exploring with those national leaders over the coming weeks. We will be doing this every other week going forward. So set your alarms to every other Wednesday at 7 o'clock in the morning when these will go live. I think the other aspect we will be trying to pick over is to try and link what Michael West was saying in episode 13 and what the chief execs in episodes 1 to 12 in series 1 were talking about, and saying what is the role of national leaders. So if I just do a quick recap, so we remember, developing a great culture is often and will always be around great values and behaviours of leaders and our staff, a simple framework for the organizations to deliver great change. What are the 2, 3, 4 things that I, as an individual, my team, my organization, are going to be delivering on this year? What's the clear accountability framework that we operate in, so I know that I am doing my job well and that I can discharge my responsibilities right? It's ensuring that we're listening and hearing and acting on what both our patients say, but also on what our staff are saying to us, and developing great leaders who take responsibility, whatever seniority those leaders are, to manage behaviours and do things well in the organisations. That's a very quick sweeping summary of those 13 conversations that I have had over the last few months, and there's some real practicalities that those leaders pulled out. But when it comes to our national leaders, when it comes to Ian as the Chief Executive of Care Quality Commission, it starts to be a different conversation, doesn't it? About actually a simple framework. I'd say that some of our frameworks are quite hard on a national basis, where at a organizational level, we like to have simplicity, we like to have focus, we like to keep things understandable for everyone. So how do we link those two things together to say, actually, does the national approach confuse the local approach? I'm sure that's not true in everything, but that's one of the themes I will unpack with people. Actually, what is the role of regulatory elements of our workforce to support values and behaviors, leadership, and a great culture in our organizations? Do they have any role, or do they just set the frame that we all need to operate under or within to make sure that care is delivered effectively and in the best way for our local residents? So those will be a taster, folks, of what I want to unpack with the leaders of these really important functions and organisations that straddle both England, Ireland, Scotland, Northern Ireland, Scotland and Wales as well, to say, how does that happen? I hope also it'll give you a bit of an insight into some of those national leaders. We don't often get to know and hear from them, except for perhaps when things go wrong. And so therefore it'll be a chance for us to get underneath the skin of what makes them tick as leaders in their respective areas of work. I hope they will be useful and thought-provoking sessions. And folks, I really would like to get your views on what I might say to those national leaders and what I might pose to them over the coming weeks and months. If you go on to the podcast site and wherever you access them, whether it's into Apple or Spotify or elsewhere, you will see my details on there. And so it'd be lovely to hear from you listening to this, to say, what are the things that you really want to know and want to hear about when it comes to the leadership and culture approach of our national leaders supporting great delivery in healthcare? It will be interesting. Hopefully it'll be thought-provoking, and I look forward to joining you over the coming weeks, every other Wednesday, to hear more about leadership and culture in healthcare on this podcast. Thank you. Look forward to speaking to you and hearing from you soon. Bye.